Hey, Team BCN. Thanks so much for listening to today's podcast episode. Danielle Root, Nursing Resource Officer, joins us today to kick off our celebration of Nurses Week, May 6th to 12th. She'll be sharing a little bit about the fantastic work our nurses do across our service lines, what it means to her to be a nurse, and her role at Bluegrass Care Navigators. She joined us in the January 23rd episode about clinical ladder. So Danielle, thanks for joining us and welcome back.
Thanks for having me back, Heidi.
Absolutely. So you've worked at Bluegrass Care Navigators for almost 5 years now and help inform nursing practice, policy, and professional development across service lines. How would you describe your role at BCN?
Yeah, so as a nursing resource officer, my role is to support our nursing teammate, but I do it in an indirect way. So, of course, all of our nurses report up to their nursing supervisors, and then those supervisors report up to their executive directors. But the nursing resource officer role truly is a resource to our operational leaders and our frontline clinicians. More specifically, I help inform policy and clinical protocols and practices. And I'm really fortunate to have a seat at the table with our exceptional leaders.
You started as a nurse. So why did you want to be a nurse?
Well, I think that most nurses have lots of reasons why they want to be nurses, and I'm no different. But one of the things that I've always known about myself is that I'm a helper. Mr. Rogers said it best, I think, when he talked about when he was a young boy and he would get scared of things on the news. His mom would always tell him to look for the helpers. There are always helpers in crisis situations. And as a young girl, I often looked for the helpers when things were looking a little scary. And I knew even then that I wanted to be one of those helpers when I grew up. And so, what better profession than nursing to be able to help? Initially, I was able to help my patients at the bedside. As I moved into manager and director roles in acute care, I was able to help not only the patients, but also frontline nurses and CNAs. And now here at BCN, I have the opportunity to help our operational leaders, as I've said, and our frontline clinicians. So yeah, I just love nursing.
And you and other nurses talk about being a nurse. It is a role, it is a profession, but it's also kind of who you and who they are as a person. It's kind of like a mindset, right? So what does being a nurse mean to you?
I think it means a lot of things. I will share that if you're one of my close family members or friends and you're in my presence, I have a tendency to assess you, even when maybe you don't want to be assessed. We start to notice things. One of the first things that we learn in nursing is to be mindful of safety and your surroundings and your environment and to keep a safe environment. I think that being a nurse really becomes more than just a thing that you do at your job. I think it really truly becomes your master status in that everything you do it through a nursing lens. I find that when I'm trying to solve a problem, I lean into my nursing process to help solve that problem. So I think that really nursing it encapsulates us, especially those of us who are really passionate about it.
Danielle, you mentioned the nursing lens and nursing process. What is nursing lens and process as you approach everyday life?
So the nursing process includes the basic elements of assessment, diagnosis, outcomes, and plannings. For my nurses, think care planning. Implementation, that's where we put our interventions into practice, and then evaluation, right? So anytime that we're faced with a problem, be it the patient's problem, and for me, one of my own problems, I often take a moment to assess what the problem is. And then I diagnose, right? I identify or name that problem. And then I start planning, right? I start thinking about what outcome am I trying to achieve or what is the goal. And then I put a plan together and then I implement that plan, right? So I move forward. Nurses are doers. So then I move towards implementing my intervention, if you will. And then at the end of all of this, I want to stop and look back or evaluate to see if did my plan work? Is my problem solved? Are there any new additional problems that have come up based on what I've just gone through? Or can I decide that, yes, I did have a problem or a crisis or whatever. And now upon evaluation, I see that problem no longer exists. So it really does become part of your mindset and your problem solving capacity, or it has for me.
Yeah, that's really awesome. That's really awesome. I love that. So, how would you describe? We have a variety of nurses within our organization in a variety of roles. How would you describe, and I'll ask you more about the roles part in another question, but how would you describe the work our nurses do daily?
Oh, I would say our nurses are just amazing problem solvers. Every day, from day to day, we start out and we have a plan, right? We think that this is what we're going to do today. But then a phone call comes in, or someone has a question, or something occurs where you have to pivot. And I think that our nurses are so incredibly flexible, and they have to be in all of the different nursing roles here at BCN. They really are patient centered, and they also are very collaborative. Our nurses work together quite well, I feel. They learn into each other for knowledge and insight, and then they also utilize the tools that we have available to help drive their practice. Again, I think that what they do daily is flexibility, but they are very flexible while they're providing exceptional patient care. And we know for our hospice friends, well, really all of our patients, that we not only care for the patient, but we care for the entire family unit. So, nursing is challenging, but it's also so rewarding.
Mm-hmm. And it's really, especially at BCN, it's really patients first, right? And I think that's the beautiful thing that our frontline clinicians do every single day,
Absolutely. And that's usually where the pivot comes in, right? So you think you're
right?
going to see X amount of patients, but then this other patient has a need. And so the nurses prioritize, and then they move their day around and they meet that need of that patient. And it's really incredible to see it in practice.
Mm-hmm. For real. So, as we've hinted at, and as people listening probably know, there are many different types of careers and jobs in nursing, in addition to the RN and LPN roles that a lot of people think of. So, could you talk to us, Danielle, about some of the unique nursing roles that BCN has in home health, transitions, PACE, hospice, and more?
So, hospice is one of our largest service lines, as we all know, and many of us know that our hospice nurses are there to help support the patients and families through end of life, and it's hard work, but as I've said, it's very rewarding work. Our home health service line looks a little bit different, right? So, with our hospice patients, we know that they are progressing towards end of life, but with our home health patients, often we are there for a short period of time, and we are often addressing a specific problem to help that patient improve. So it might be that they've had surgery and so they need wound care from a nurse. They also have physical therapy and occupational therapy and other services that are available to them through home health. But really, we are trying to help progress that patient towards optimal health and wellness. Our transitions teams are just incredible. They work closely with our hospitals to help patients be prepared to make it at home, right? So, one nursing theory is that nurses help patients progress towards independence. And I think that our transitions nurses play a huge role in that. They make sure that our patients are aware of all of their follow up appointments with their outside providers. They make sure that they have the medications, that they are aware of the medications that they're supposed to continue, but that they also have access to those medications, or maybe even transportation to get to those medications. And they just kind of follow along beside them a bit, just to make sure that, yeah, this patient's back home and they have all of the resources in place to help them be as successful as possible at home. Ultimately, with the goal of helping the patient in their home so that they don't have to return back to the hospital.
Mm-hmm.
Our PACE nurses are just so incredible. So we, as most people know, provide all of the health care for our PACE patients. So our PACE nurses have an even larger job in that they are also helping our patients work towards optimal health. But then our goal is to keep them there, right? So we want to keep our PACE patients healthy and happy. And that includes ensuring that they have socialization, that they have appropriate activities, that they're getting the preventative care that they need to help keep them healthy, right? So we want to stop problems before they occur. So we make sure that they have the appropriate nutrition and, as I've said, the appropriate activity and the right amount of socialization. And our PACE nurses really just are exceptional, and they are able to build those tight relationships with those patients.
Danielle, thank you for giving us this overview of some of our nursing friends. Tell us a little bit about our palliative care nursing friends and the work that they do both in palliative and home primary care.
Yeah, so our palliative care nursing friends are so essential to the care of those patients. As we know, palliative care helps patients with chronic illnesses with the lens towards managing symptoms, acute and chronic symptoms. And our palliative care nurses, both in our pediatric palliative and our adult palliative, help support our Department of Medicine, our providers, to provide that essential care to our patients and families. They really work alongside those providers and help with coordination of care and scheduling and ensuring that the needs of those patients are met. We also have, for our hospice friends, they may not know that our nurse liaison, the nurses that help us with all of our controlled medications, all of those scripts and communicating between the provider and the pharmacies, including our hospice pharmacy, are actually part of our palliative care team.
So the nurse's role is constantly evolving, Danielle, but it really kind of shifted during the public health emergency that we just came through. So talk to us a little bit about what the nurse's role was during the public health emergency.
Yeah, that's a pretty broad question.
Yeah.
I think that nurses who are often accustomed to working in teams and groups and alongside, say, our CNAs and our social workers, we found that the care that we were providing during the public health emergency looked a lot different. So it's no surprise that as COVID-19 started spreading out, we started trying to limit opportunities for the continued spread of that virus. And so in some instances, patients only saw their nurse in person. Sometimes it was only the nurse that was able to go into that home early in the pandemic. Lots of things changed for nursing, right? So in the past, we would maybe delegate or ask a CNA to come in and help with personal care. And early in the pandemic, what would happen is that the nurse, because she or he were maybe the only ones going into the room, going into the home, would provide all of that care while they were there. We also had the introduction of telecare services. So we all learned, and those of us who were in the offices remember very vividly that we transitioned from in-person meetings to telework or using our virtual meeting space. And that also trickled into our patients and families' homes. So we began teaching patients and families how to use their smartphones or their computers to connect them with other members of our care team. I think initially, early on, our social workers would do telehealth visits. Face-to-face visits with our providers occurred via telehealth. And telehealth really has been beneficial to healthcare. And it's something that I'm happy to say we did not lose as we started to near the end of the public health emergency. It is something that has been integrated into healthcare, and I think that it's something that's going to stay. We have been able to actualize the benefits of telecare and seeing the patients in real time, visually, and hearing them, within the virtual space.
Yeah.
So I think that it's beneficial to everybody, both the nurses and the patients and families.
Yeah. So the virtual telecare, it kind of enlarged the playing field. I mean, there were some challenges with it, and probably still are, because you can't replace that face-to-face component. But I think in some ways, and you may disagree with me, and that's fine, it's kind of leveled the playing field for healthcare because now more people can access it.
Oh, absolutely. And one area that we've seen that is in our Southeast Kentucky region. We know that there is a lack of providers in Southeastern Kentucky. And one of the things that we've identified for many years is that it's difficult to recruit doctors to come into Southeastern Kentucky and live there, right? So we have been able to offer that care virtually. That is taken off across the globe in healthcare. And for our nurses using telehealth, it could be, let's talk about maybe one of our on-call nurses. It could be that an on-call nurse is on the complete opposite side of a mountain and receives a call from a patient or a family. And you can hear when you're on the call with them that they are in distress or that they might feel anxious about this situation. And now we have the opportunity in real time using our telecare resources to get our eyes on those patients and to offer that calming presence, even though we aren't physically present. It really has changed the shape of healthcare, and it's so exciting.
Yes, definitely. So, as we're talking about how nursing is continuing to evolve, there's so many options to pursue within nursing. And as part of Nurses Week, it is Student Nurse Day on May 8th. So, why is it so important to encourage younger people to go into healthcare?
Oh gosh, because we need them. We know that we've had a huge decrease in the nursing workforce, even before the public health emergency. And it really is a great profession. It's so rewarding, especially for those of us who feel passionate about helping others. But we really need to encourage our young folks to consider nursing as a career opportunity. And I would add to that, as a nurse, it's really important for us to support and encourage and nurture our nursing students. So, back in the 90s, when I came into healthcare, there was a saying that nurses eat their young. And even then, nurses were saying, that's an old adage and it's not anything that we should do. What we need to do is nurture and support our new nurses because they're going to be taking care of us one day. They're going to be caring for our loved ones one day. And I think that as nurses, it's our job to really nurture and support that nursing student. We remember how hard nursing school it is, so very difficult. And if we can love on our new nurses and encourage our new nurses and offer them all of the educational opportunities and resources that we as existing nurses have at our disposal, I think that we can only help ourselves by helping our nursing students.
Absolutely, absolutely. Offering a hand up is so important. I mean, we all should do that, you know?
Absolutely, yes.
Yeah. So when I think of being a nurse, I think of, hospital bedside. And I love that BCN offers like a home, I mean, we have inpatient units, but offers more of a home-based approach. So, and other benefits as well. So, what is the benefit of working with an organization like BCN who values its nurses and the care they provide?
Yeah, so I think I've mentioned this on previous podcasts. I think that we are just so fortunate to work for Bluegrass Care Navigators. We are not for profit, which really allows us to lean into our mission to provide that patient centered care. Oftentimes, I've been involved in conversations with leadership about how can we best support our nurses. All of the decisions that are made at BCN as it relates to things like our benefits or our pay or, you know, any of the decisions that are coming down often have the question at the either at the beginning or at the end, how will this affect our nurses? How will this affect our frontline clinical team? And I think that that's a question that doesn't often get asked in other hospitals.
Mm-hmm.
Excuse me,
Definitely.
or healthcare arenas. I think that we are so fortunate that we have a leadership team that really does support us in practice. They really want us to be able to provide the best care possible to our patients and families.
Right. And from just observing, I believe the theory is if we value and support our team members, then that will equip them to go out and provide the care that we hope to be able to provide to our patients.
Absolutely. Absolutely.
Yeah. So as you think about that work and that care that you and your fellow nurses do daily, what are you especially proud of?
Oh, I am so proud of our nurses. Heidi, I am so proud of our nurses.
There's a lot to be proud of.
There is a lot to be proud of. I'm coming off of a hospice 2023 world tour where we went out and educated our nurses on updates that were coming down the pike. Some of them were related to the Joint Commission survey, some were related to internal audits or external audits that occurred within BCN. But either way, there were changes that were coming down. And I just could not be more proud of the critical thinking that I saw demonstrated in those meetings. The nurses listened intently. They had questions. They were thinking about how would this change impact their practice? How might this change impact the outcomes of the patients? And it is just so rewarding and uplifting to see their nursing process, right? Their
Mm-hmm.
critical clinical minds just processing as they were getting that information. And I think that we, really are blessed to have the incredible, exceptional nursing team that we have working at BCN.
Absolutely. Absolutely. Danielle, this has been a delightful conversation once again. Before I let you go, is there anything else you'd like to say that we haven't already talked about?
Yeah, I think that it's very obvious that I'm passionate about nursing and I'm passionate about supporting our frontline nurses. So, as you go into Nurses Week next week and beyond, I would just encourage everybody to stop and reflect about a time that maybe a nurse has impacted your life or the loved one of someone in your life. And then just offer that gratitude and appreciation to our nurses. So when you see them out and about bustling around, I promise they are not just busy to be busy. They are truly busy, and often they are processing as they're walking. So if you get a second to just let them know that you appreciate them and that you value the work that they're providing our patients and families every day and each other, I'm sure that they would appreciate it. And Heidi, thank you so much for having me today. It was a great opportunity. And anytime you want me to talk about nursing, I am ready.
Well, I am here for it. You are welcome back anytime. So thanks so much, Danielle.
Yeah, thank you.